Welcome back to the channel. In today's video, we will be exploring round cell tumors, a group of lesions that may appear deceptively similar under the microscope but represent a wide variety of important pathologies in the oral and maxillofacial region. So, let's begin. Round cell tumors are a broad category of neoplasms made up of small, round, and relatively uniform cells. These tumors usually exhibit scanty cytoplasm and densely stained hyperchromatic nuclei. This characteristic morphology helps them to group together even though they differ greatly in the origin and behavior. Despite their different biological behaviors, these tumors share many histological features. Most appear as dense sheets of round cells with a high nucleocytoplasmic ratio, where cytoplasm is usually minimal and nuclei are intensely stained. Mitotic activity and necrosis may also be present depending on the tumor. One of the diagnostic challenges is that many unrelated tumors adopt this small round cell appearance because immature or undifferentiated cells naturally show very few distinguishing features. This is why immunohistochemistry and molecular testing are essential for accurate differentiation. In the oral and maxillofacial region can be grouped based on their tissue of origin, which mainly includes lymphoma, Ewing sarcoma, rhabdomyosarcoma, multiple myeloma, and very rarely neuroendocrine tumors. So let's begin with the most common round cell tumor in the oral cavity, which is lymphoma. Non-Hodgkin's lymphoma frequently involve the oral cavity, including mandible and palate, oropharynx, where it can present as a swelling, ulceration, or any proliferative mass. Microscopically, lymphomas typically show diffuse sheets of round cells with scanty cytoplasm. High-grade lymphomas may present a classic starry sky appearance due to tingible body macrophages, which is seen in Burkitt's lymphoma. Because they mimic many other tumors, immunostaining becomes very crucial. Important IHC markers include CD45, which confirms hematopoietic origin. B-cell lymphomas express CD20 and CD79A, while T-cell lymphomas express CD3. These markers help classify lymphoma subtype. Now, let's move on to the next lesion, which is Ewing sarcoma. Ewing sarcoma is a part of small round blue cell tumor family and typically affects children and young adults. In the oral region, it may involve the mandible and present as a swelling, pain, or mobility of the teeth. Histologically, Ewing sarcoma is composed of uniform round cells with clear to pale cytoplasm due to the presence of abundant glycogen. Necrosis is also common. The cells are arranged in sheets and nuclei shows finely dispersed chromatin. Ewing sarcoma is strongly positive for CD99, showing a distinct membranous staining pattern. Molecular testing often reveals the EWSR and FLY1 gene fusion, which is a valuable confirmatory marker. Recently, NKX 2.2 is also considered to be a very crucial IHC marker in case of Ewing sarcoma. We will be discussing all these markers in detail in the separate video on these lesions. Rhabdomyosarcoma is a malignant tumor of skeletal muscle origin, commonly seen in children and adolescents. In the head and neck region, it can occur in soft tissues, orbit, or any mucosa. Although often classified as a round cell tumor, rhabdomyosarcoma may show cells that are strap-shaped or tadpole-shaped, reflecting muscle differentiation. Cross striations may occasionally be seen but are not commonly observed. IHC markers such as desmin, myod1, and myogenin support the diagnosis by highlighting muscle differentiation. These help distinguishing rhabdomyosarcoma from other small round cell tumors. Though rare in the oral cavity, neuroblastoma and other neuroendocrine tumors can appear as round cell neoplasms. They often show rosette formations such as Homer-Wright rosettes, indicating neuroectodermal differentiation. Plasmacytoma and multiple myeloma may also mimic round cell tumors. Plasma cells are recognizable by their eccentric nuclei, clock phase chromatin, and perinuclear HOF. CD138 and light chain restriction studies helps to confirm the diagnosis. To differentiate round cell tumors, always consider a systematic approach. Evaluate the patient's age, look for the key histological clues, use IHC panels, and integrate clinical and radiographic findings. This structured method helps narrow your diagnosis efficiently. Most round cell tumors are aggressive malignancies, requiring rapid diagnosis and coordinated treatment. Early identification and referral can make a significant difference in patient outcomes. In summary, round cell tumors share similar microscopic appearances but vary greatly in the biological behavior. Recognizing their features, understanding the diagnostic markers, and applying a structured approach are essential in oral pathology. Thank you for watching. If you found this video helpful, please like, subscribe, and share it with the fellow dental and pathology students. See you in the next video.